Welcome to Thrive with Pride from Age Options, an online space for LGBT older adults and those who care for them. This month, we spoke with Jesus Armando Enriquez from the Illinois Senior Medicare Patrol, or SMP, at Age Options. In this very brief introduction, Jesus reviews the basics of protecting yourself from Medicare fraud and scams. Make sure to see the video description below for more information, including a link to the slides used in this presentation and the SMP's new website, where you can sign up for fraud alerts, download tip sheets, and more. After you watch this video, please fill out our very brief satisfaction survey, which is also linked in the video description below. It's my pleasure now to introduce our presenter, Jesus Enriquez. Jesus Armando Enriquez is an outreach and information specialist at Age Options, where he works with the Senior Medicare Patrol, or SMP, to educate older adults about healthcare benefits and empower them to protect themselves against healthcare fraud. He conducts community outreach, makes presentations at various organizations, and participates in community events and health fairs to educate the public about healthcare fraud. His background includes working in nonprofit, community health, adult education, and community outreach settings. Jesus was an ACA navigator at the Alliance for Multicultural Community Services in Houston, Texas, where he did community outreach and assisted people with enrolling in the Affordable Care Act insurance. Jesus was also a health navigator and a health promotion outreach associate at Erie Family Health Center, where he helped uninsured and underinsured patients research health topics and connected them to community resources. Jesus also managed referrals and conducted patient scheduling and represented Erie at health fair and events throughout Chicago, giving presentations on health topics. So Jesus, welcome to Thrive with Pride, and whenever you are ready, the floor is yours.
Okay, thank you so much for that wonderful introduction. As always, it's always nice to be with great partners like you in your program. So this is Jesus Enriquez from Age Options. So we have this presentation on our screen right now. And I just want to say you are one of the first groups that you'll get to see as brand new. We have adopted friendly design and more easier to read, so it's easier to remember because this concept it's very important. We have to be preventing Medicare fraud, and the SMP is also a national program and a statewide program. So I will explain that in a minute. So the SMP is federally funded by the Administration for Community Living. And SMP is as well managed by Age Options in coordination with other agencies statewide. Agencies known as Area Agencies on Aging in the state of Illinois. There are around 13 agencies in different areas, and we partner with them through volunteers and through direct assistance in case of fraud or education as well in community events. So I'm gonna share this video, introduction PSA video about our program.
Did you know Medicare is under attack from fraudsters, scammers, and con artists?
This is for real?
I can't believe it.
Just how big is Medicare fraud? How about a $60 billion crime that we all pay for?
That's what makes it so incredible.
What can I do?
For starters, you can turn to the Illinois Senior Medicare Patrol. SMP will show you ways to spot and report Medicare fraud.
You're a fraud.
It's fraud. What next?
When you call SMP, you can help shut down Medicare fraudsters and bring them to justice.
That's the plan.
Amazing.
It's up to you.
Fight fraud. Contact the SMP at 1-800-699-9043. That's 1-800-699-9043. Call today. This video is paid for by the Administration for Community Living, a part of the U.S. Department of Health and Human Services.
And so our motto, our legend, our statement is to preventing Medicare fraud. So how do we do that? Well, there's very important principles on how to prevent Medicare fraud, because during my work teaching seniors how to prevent yourself from Medicare fraud, sometimes they say that, oh, you know what, I don't need this information. It's not helpful for me because I'm not in that problem. But it's important to teach them the tools and the requirements so they don't fall themselves into fraud, because as you saw in the video, $60 billion have been lost. What if we curtail some of those $1 billion? What if it's only 20 billion? what if we avoid these seniors from being in fraud to begin with? So the first step that we have to do, everything is interconnected. So educating yourself on Medicare fraud. If you don't know about the current fraud trends and what's happening in your community, you might be likely to get scammed. Second, only sharing your Medicare number with your doctor. It's not rocket science. It might be common sense, but sometimes it can happen to anyone. You get the call that you have an interest in, and you give your personal information. So share information only with your professional government agency or your doctor. Getting a medical summary of your visits, that's the next step. Making sure you're proactive about the services you're getting, making sure you're getting what you're supposed to be getting. And then entering this information into a personal healthcare journal. So we have free personal healthcare journals available in our in-person presentations. And those are records of your daily care with your doctor or doctor's visits. And this is important not only to keep track of your health, but also to know what are they billing to Medicare. Then the next step is to compare these personal healthcare journal, which can be also a notebook, and you enter that information, and compare this information with your Medicare bill or Medicare summary notice. And if you see something suspicious that doesn't match, you can ask questions about potential Medicare fraud, because it's okay to ask. One thing that I always tell seniors and people with Medicare, you can always make questions. Don't feel bad about making questions, because if you don't want your questions answered, you might be more likely to fall into fraud. So there's no right or wrong question for that. Now, continuing to this, as in the video, 60 billion of taxpayer dollars are lost to Medicare every year. So 60 billion couldn't be spent with senior agencies, could be spent with senior meals, could be spent with many other programs. But they're going to trash every year, and only a certain percent is recovered, which it's almost no use for that. So your benefits could be get used to the fact that the scammer convince you into getting these unnecessary services. So likely you get a call from somebody trying to offer you something that it might be attractive to you, but you really don't need that service. You might end up having to pay money out of pocket for something you never use or you didn't need at all. So again, just because they say it's free, remember in Medicare you have to pay. There's always a cost. There's always something that you might have to pay. And a lot of times with scammers, it's not only a percentage, it could be almost the whole value of the service. Now, we have classified these in easy sections for scams. So the durable medical equipment, the genetic testing, the new Medicare Card scams, the home health fraud, and there's a lot of new information over here. So the DME is durable medical equipment. So imagine walkers, back and knee braces are some examples of durable medical. And why do they call it durable medical equipment? Because you can use it so many times. And it's not disposable. You can use it for certain times, and it has a life cycle. So scammers cannot fit your equipment over the phone. And as a reminder, don't give your Medicare number to somebody that you don't know, because they might use that information and bill Medicare for services you don't need. And again, look for in your Medicare summary notice for equipment you never needed. And a lot of times, some of the seniors don't get the equipment. They don't get anything. They just get a bill. And DME is not free. They always have a copayment. And the same reminder, just your doctor, talk to him or his or they, and they will be able to get to your equipment that you need. Genetic testing, genetic tests are not ordered by your doctor and involve a cheek swab. When somebody calls and says, okay, you know what, your doctor ordered me to do a genetic test. Can I have your Medicare number? That's a red flag. Medicare does not cover genetic testing a lot of times. It has to be a lot of paperwork and analysis, and it's very complicated. It's not just covered straightforward. So as you can see, it could be a scam if they're asking you for your Medicare number. Now the scammers in the new 2.0 version of the genetic testing scams, they state that your cardiologist requested these tests. So they go far ahead saying that you actually have a cardiologist requesting these tests to be done by you. So now the scammers, once you get your Medicare information, they can commit medical identity theft. And please remember, they have access to your saliva, to the cheek swab. So they might be able to get this DNA away from you. So they still don't know if this DME information, I mean, this DNA information is out and about in the black market. We still don't know that, but it's a risk that people have to become a victims of that. So also read your summary notice and always look for unnecessary genetic testing. Medicare has to pay, not only pay thousands of dollars, in average, they pay $10,000, $20,000 for every cardiac genetic testing. So imagine if we have 10 people being scammed times for 20,000, that's $200,000 right there in scams. Scammers, in order to bill Medicare, they use telemedicine to order these tests. And as you know, you might have used in the pandemic telemedicine. It allows you to talk to your doctor without leaving your house. The issue with this is that they say they have their own telemedicine agents where they call you back and they arrange some of those tests and they send you a cheek swab. That's what they're able to do everything on their own hands. Of course, that is illegal. Now, with genetic testing, we also have a newer scam as well. So have you heard this called when scammers try to offer you a new Medicare card? Well, the variation of the scam is that they are prompting you to get a plastic, a gold, or an intelligent card with a chip on it. Scammers are also trying to ask you for, of course, your Medicare number or to confirm your medical number while offering this card. Scammers, again, bill Medicare for unnecessary tests and medical identity theft. So they don't get their quote Medicare card. They just get a lot of bunch of bills in their Medicare summary notice. There's no need to take action since there is no need to update your Medicare card. Medicare is not allowed to contact you or to ask for your personal information. Never give your Medicare number away to these callers. So that's a rule of thumb. Now, the scammers, when the home health fraud scam, this is a scheme that has been in Illinois for multiple decades. Back in the 90s, possibly 80s, scammers are offering housekeeping services or other unnecessary services to you. And scammers are calling you stating that Medicare provides this free benefit for you. And the only information they need for you is, you guessed it right, it's your Medicare number. Scammers bill Medicare instead for physical therapy services that they never provide. What they can provide is somebody to go and clean your house, do housekeeping tasks, and maybe blood pressure readings, and that's about it. But a lot of these victims do not get any services at all. They just get the bills. Read your summary notice and look for unknown charges. Remember, home health care is not free under Medicare, and it has to be certified by your own doctor. If you need home health services, you need to talk to your doctor because they have to be several conditions to be met. And another reminder about home health support or home aid or caregiving services, they're not exactly the same thing. The state of Illinois has the community care program helping seniors part-time. And a lot of times seniors get confused with the community care program and home health through Medicare. So this is why it's important to know these programs. And if a senior has a question about this program, we can always answer that. I'm gonna skip the questions right now. We go on that until the end. I have a reminder here that we have what we call the Illinois SMP Alert. These alerts are sent every other Monday with very good information about recent scams. They contain other helpful information. And we have a new website that I'm inviting you to visit, illinoissmp.org, illinoissmp.org, one word. We will have a lot of information about the PSA video that you can share. It's in YouTube. We have our tip sheets that can be shared through the community that are user-friendly. And we have a way that in the bottom of the page that you can register for free to these email fraud alerts. You can share this thing, you can forward to other organizations. So the more people we get registered, the better, because we're also listing our list of community events. We're listing presentations, we're listing possible bingo events in person that we are going to start this week, actually. Tomorrow in Maywood and then later on in Markham the same week. So that's very exciting. Now, in order to volunteer with SMP, volunteers can conduct outreach events, including health fairs and presentations, meet new people, create some connections that are always essential. If you want to volunteer, we have Marina Silva, which is our volunteer coordinator with the SMP program. She can be reached at marina.silva@hoptions.org, or you can call our Illinois SMP number, 1-800-699-9043, which is also the H Options Information and Assistance line. And they also will be happy to direct you to SMP. If you have any questions on fraud or volunteer, or you want to request also a presentation with us. The Hotline Resources is one of the most liked section of our whole presentation. We always get asked for a copy of this because they have good numbers right there, like the SSA administration, Better Business Bureau, Identity Theft Hotline, which is very, very essential during the last 3 years. The Elder Care Senior Services Locator, they have a phone number. I didn't know that. Eldercare.gov, that was the link that people usually get to. But what happens if somebody doesn't have access to technology? So the locator, it's free. It's available to use for any senior in the country. And they can get a lot of information from the local agency, what it is and what services they provide. And the last number is very essential when you are doing open enrollment through Medicare. You have a question about Medicare coverage. You have an issue with, let's say, some medicines and or your coverage area. So the Illinois Senior Health Insurance Program is funded by the government as well. So that's a good resource that is available the whole year. And I will be happy to share the slide deck with Kate, so later Kate can share with you all. But our phone number to contact the Illinois SMP, reminder, is 1-800-699-9043. And this presentation is brief. We usually feature a bingo section in person. But however, in the future, as if we do more of the Zoom presentations, we might be able to do it online as well. So we are still working on that. But thank you so much, Kate. So I'm going to open the opportunity for comments and questions.
Thanks again to Jesus for a great presentation. Again, please see the video description below for a copy of his slides and more information. We hope you'll help us by filling out the brief survey you'll find there as well. Please join us for our next monthly event on Tuesday, June 28th, 2022, when we will host a live bingo event for Pride Month. World famous Bob and DJ Lingerie will host a fabulous hour of bingo with games and prizes galore. It's completely free to join, but you must register in advance to play. Go to thrivingwithpride.org/bingo to sign up and receive your cards. Thanks for watching, and we hope to see you in June.